Our first aid scenario training video is of substance abuse. This is our scenario. You find a man passed out on the ground, surrounded by pills, which appears to be an overdose of some type. We will show you our steps on how to address the situation and what to follow and how to follow through. As you find a person passed out, the first thing you want to do, as you see something that might look like a substance abuse issue, you want to check the scene to make sure it's safe and that there's no issues that you would be harmed by or others are harmed by, or if the person is belligerent and threatening, you want to check those situations first. Then you check the person to see if they're unconscious or responsive. If the person is not responsive, you want to call 911.
Call 911. We have a possible overdose. He's not breathing, but his heart's beating.
So as you check your patient, you want to see what his vitals are, if he is breathing or if his heart is beating. While they're calling 911, you want to keep him safe. So you want to, if he's not responding to you, but his heart is not beating, you want to lay him down flat on the ground and begin CPR compressions. Make sure your compressions are 30 compressions and 5 cycles. If he is continuing to breathe, you do not need to breathe for him. If 911 shows up and he's still unresponsive, let them take over, or if somebody else comes to help you do compressions or help you count. Until help comes, keep doing compressions if the patient is not responding and his heart is still not beating. Doing 30 compressions like typical CPR without the breaths if he is still breathing on his own. Symptoms may be trouble breathing. As you find somebody unconscious, they may be confused or seems to be losing consciousness. They may have persistent chest pain or pressure. They could have pressure in the abdomen that does not go away, or vomiting blood or passing blood. They could have a seizure, a severe headache or slurred speech, or may act violently. These are all symptoms of substance abuse issues. If none of the other conditions are present and you have good reason to suspect a substance was taken, you want to call the National Poison Control Center hotline at 1-800-222-1222 and follow the call taker's directions. Try to learn from the person or others what substances may have been taken, and make sure you are calm and reassure the person if they are alert, and keep the person from getting chilled or overheated with blankets or other items that you may have around. Some Saturday nights you may find this scenario when you're out with friends. The situation would be somebody who's had too much alcohol to drink, or possibly other substances mixed in as well. But in this situation, we'll see that he will be under the influence of alcohol and will be put in a dangerous situation when our passerby finds him.
You okay?
She will check him to see if he is alert, and if he is not alert, the safest way to keep him is to keep him from choking on his own vomit if he should get to that position. So when she finds him in this situation, she's going to check to see if he is breathing and is everything safe in the situation. As she finds him laying on the ground, she's going to check the scene to see if there's any clues as to what might be going on. But she is in the middle of a party, as you see the party situation going on all around him with lots of people drinking. She's going to check him and see that he is not responsive, and she is going to call for help.
Call 911.
Seeing as he is still passed out and he is not responding to her, he is breathing, but his heart is still beating. She's going to roll him in the recovery position just to make sure that he is safe if by some chance he should vomit, so that he does not choke and drown on his own vomit. She will roll him onto his left side, bending his leg up and propping his back in order to prevent him from rolling back over. His knee will be bent in order to keep him situated so that if he should vomit, it will come out of his body versus him choking on it and gagging on it. If he is still not responding, help is on their way, and you keep him safe in the situation. As you've seen in both of these scenarios, there are a lot of different symptoms when it comes to substance abuse and misuse. Prevention is the key to substance abuse. A lack of parental supervision, breakdown in family structures, a widespread variety of availability for substances, peer pressure, low self-esteem, and a history of substance abuse in the home and community environment may also add to the risk of substance abuse and misuse. In order to prevent misuse of medicinal substances, make sure you read the product information and use products only as directed. Make sure that you are asking a physician or pharmacist about the intended use and side effects of the prescription and its interaction with over-the-counter medications. If you're taking more than one, check for possible interaction side effects. Never use another person's prescribed medication. What is right for one person is seldom right for another. Always keep medication in their appropriate marked containers and destroy all out-of-date medications. Time can alter the medical composition of medications, causing them to be less effective and possibly even toxic. And always keep medications out of reach of children.